Hello, I'm Ruth Tal-Singer, President and Chief Scientific Officer at the COPD Foundation, here to congratulate the American Association for Respiratory Care on its 75th anniversary. It's easy to take your breathing for granted until you can't. For 75 years, the AARC and the respiratory care professionals it represents have worked tirelessly on behalf of those who can no longer breathe easily and to advance the art and science of respiratory therapy. In the AARC's early days, the United States faced a tremendous public health threat in the form of the polio epidemic. The organization played a vital role in developing the new profession, then called simply inhalation therapy, into an essential component of every intensive care unit. Over the ensuing decades, these pioneers continued to expand their scope both in and out of the hospital, bringing their training and expertise to bear wherever there was someone having trouble moving air. Today, we hear the echoes of the polio epidemic as we face a new public health threat. Respiratory therapists are again challenged to their inestimable limits. They have had a crucial role in COVID-19 pandemic, helping those struggling with shortness of breath. For those who can no longer breathe at all on their own, they are first to rescue with assisted ventilation, oftentimes leaving their own families for days on end. Wearied by this storm of uncertainty and frequent loss, they have still risen to the challenges as they always have. We can count on their creativity and innovation as they continue to drive healthcare forward for the people we care for. At the COPD Foundation, we're fortunate to work with several respiratory therapists from a variety of clinical backgrounds. While working away from the bedside is often considered a non-traditional role for an RT, their clinical knowledge and experience is critical to our success. They are shining examples of the dedication and professional excellence of the AARC. As a patient-centered organization, the COPD Foundation recognizes and appreciates the work that is being done by the AARC to provide guidance, education, and resources to the many respiratory therapists who impact the lives of our respiratory community. The AARC has been instrumental in setting high educational and practice standards that will continue to see the profession move toward even more impactful roles in patient care. There is no doubt that the face of healthcare is changing. We see RTs being included in roles of navigators, healthcare managers, and in telehealth space in settings like remote patient monitoring and virtual pulmonary rehabilitation. Despite the scars that COVID-19 has left on many, respiratory therapists are there to provide education and support for those individuals who cope with lasting symptoms and find a new normal. We appreciate that we can depend on the AARC to provide the vision needed to continue the expansion of respiratory therapists' role in the future. We congratulate you on this incredible milestone, and we look forward to the next 75 years. Thank you.